So we'll be talking about masquerading ROP, and so these are case studies in masquerading ROP. So masquerade basically means to pretend to be someone one is not. And there's just few case scenarios I'll show quickly in 5 minutes. So this is a 1900 birth weight baby, 35-week gestation, who came to us at 42 weeks with a diagnosis of ROP and Winter's hemorrhage. So when we examined this child, basically this child had no ROP, and he basically had difficult labor with forceps. So it's not an ROP case, it was just Winter's hemorrhage. So every Winter's hemorrhage did not necessarily need to be an ROP. This 2-year-old child was referred to us with the left eye vision squint. Right eye had peripheral avascular retina, right, and was diagnosed with case of ROP sequelae. The right eye did definitely show avascular retina in the periphery. So what does it look like? Is it ROP? So this was a full-term delivery. So this was basically a case of FEVR. FEVR is a close cousin of ROP, seen in full-term babies, typically bilateral, can be asymmetric, has peripheral avascular retina. Exudative RD can progress to TRD as well, and is a common cause of childhood leukocoria. It has a significant family history as well. So this staging typically shows closely resembles that of ROP, and usually is with or without exudate. You see, as a common occurrence in this classification. Another case came to us. There was a full-term child, 1 week old. Someone did an ROP examination in a full-term child for some reason, and they found this was a case of AP ROP. But actually, you see, this was a case of FEVR, and we basically report this case. It was a case of FEVR in first week. We lasered this case, and the other eye had TRD and required surgery. Another case came to us, 2-month-old child with pigmentary skin lesions, and he was referred to us with a case of watering eyes. We examined this child, and we found this child had avascular retina, which was documented on angiography, currently pending review. And basically, we went and lasered this case, and this was basically a case of Incontinentia pigmenti. It's a rare X-linked disorder, seen exclusively in females, but the diagnostic thing here is, in 2 weeks, you have pigmentary lesion in this eye, and obviously, they have a lot of CNS and dental abnormalities like peg-shaped teeth. And so basically, ocular abnormality occurs in 1/3 of the cases, and again, he has a similar avascular peripheral retina and can progress to fibroscular TRD, and the various diagnostic modalities to confirm diagnosis of IP. Another case referred to us, 1-year-old boy, had one eye leukocoria, other eye abnormal. He had probable diagnosis of retinoblastoma, Coats, ROP. It was a case of Coats disease. Coats disease can be distinguished because more common in boys. 94% is in unilateral, unlike ROP, which is mostly a bilateral disease. And obviously, it has a lot of telangiectasias, aneurysms, a lot of subretinal exudation, and it can also progress to various advanced scenarios. And many people treated with prophylactic laser cryo in early stages. Advanced stages via surgery can be done, but the diagnosis is not there. So when we have a case like this, always look into the periphery, and it will help you diagnose it. Another case, 3-year-old child came with leukocoria, asymptomatic, probably diagnosed with Coats and ROP. So what does it look like? If you see it carefully, it is a case of retinoblastoma. So retinoblastoma has its own series and cannot has its own diagnosis. Another case came to us, preterm 1-year-old child, diagnosed with a case of provisional stage 5 ROP. We went back, and just before surgery, we did a RET cam and we found this tumor was there. So this was again a case of retinoblastoma, which was mimicking stage 5 ROP. Another case came to us, looked like 1-year-old child, squint in one eye, central cataract, small eye, diagnosed as case of ROP sequelae. So this was a case of PHPV, of persistent fetal vasculature. Commonly occurs unilaterally, typically non-progressive, comes with retinal fibrous mass, lacks exudation, has ciliary processes, a smaller eye, and usually cataract. Another case, this is again a case of PHPV. If you look behind, again it's got that kind of thing. Another child, this I picked up from the literature. This is probably the last case, and this is a 3-month-old child, both eye not following light. So this I want to show what people think. Probably people think it's a posterior PHPV. Probably people think it's a stage 5 ROP. But this was not one of those. This was a Norrie's disease, and it's a congenital retinal dysplasia, has NTP mutations, 1/3 have hearing loss, 2/3 have mental retardation, and again it presents as a pseudoglioma, has a vascular retina, the stalk going towards the lens, and most babies are blind at birth or within 3 months. And this was more cases from the same study which I'm quoting. This is how the Norrie's disease looks like, and it closely mimics stage 5 ROP, posterior PHPV, and this is what we need to look out for. And I would like to conclude by saying that, every child who comes to you does not necessarily have to be a mimicker of ROP. Sometimes it is actually ROP itself. Thank you so much.
Thank you very much, Parijat.